a kaleidoscope which brings together different shapes and colors to create a beautiful image. We believe in bringing together people and organizations to create a collective impact, and that's why we are here today. Good morning. We are here today to mitigate the challenges of COVID-19 pandemic by finding a long-term and sustainable solutions. Thank you so much for taking a time and being here today. My name is Shankar. I will be your host for today. This is one of the most exciting impact canvas of the COVID Action Collab. Through the impact canvas, we enable collective actions to provide timely and meaningful solutions to critical humanitarian challenges. The impact canvas model brings together multi-sectoral impact-focused partners who can rally around the ultimate outcomes to provide effective, meaningful solutions that mitigate the effects of the pandemic and achieve scale, impact, and sustainability in a collective fashion. Today is a special day for all of us as we are launching the Precision Pandemic Platform, Health Platform, which will determine where diseases are spreading and provide actionable insights. Normally, the keynote address is saved for the end. However, we are very privileged to have Shri Rakesh Singh. He is the Senior IAS Officer of Karnataka. He is from 1989 batch and recently appointed as the Administrator of the Bruhat Bangalore Mahanagara Palike. Additional Chief Secretary of the Urban Development Department, Government of Karnataka. Now, for the keynote address and launch of the Bangalore City-wide initiative, Shri Rakesh Singh is a Senior IAS Officer, Karnataka. He is from 1989 batch. Over to you. Welcome, sir.
As usual, last 5 minutes we were struggling to get ourselves connected. I really don't know whether it's good morning, good evening, or what is there for people who are participating. Let me wish a good health for all of us and the people of this mankind. It has been a reasonable association for last 5 months, which gets further crystallized today when we are interacting with each other. And I have nothing much to say except that I acknowledge the efforts of a lot of people who have made this possible. And to start with, it is Skoll Foundation, WHO, USAID, and the organization Restore Health and Wellness. As you must have seen, that last almost 45 days has been extremely difficult for Karnataka, more so for Bangalore, where we reached a very high peak. Fortunately, I think with the efforts of many people and organizations and the blessings of God, things have started easing out. And yesterday we recorded one of the lower figures, something like 5,900 cases. That was yesterday, and even the recovery rate has slightly improved. But as compared to the national average of India, we are still very, very poor. The effort, what has been launched by different stakeholders, will certainly help us to understand and contain this disease in future. And together, besides containment, we'll also try to have a better preparedness as to what is there in store for future. I'm sorry I'll not be there for a long time, and before I leave, I'd like to hear others. So anything which you want to guide us in the present scenario for Bangalore, Karnataka, or even India, I request that you please guide us so that we can take it forward, and with the help of different organizations and my young colleagues in the organization Restore Health and Wellness, we'll try to translate it on the ground. Thanks for listening to me, and thanks for calling me on this webinar. I'm here. Please go ahead.
Thank you so much, sir, for your wishes and also your efforts to control new infections in Bangalore. So definitely your guidance and also inputs will help us to continue to drive the initiative. Thank you so much being here and also guiding us.
Mr. Shankar, one small input. My colleague, the chairman of Bangalore Water Supply, and his team is also available. So as and when you require their participation, guidance, or any input you want from there, they are available on this webinar. I just wanted to make it a point.
Thank you so much, sir. Thank you so much, sir. Really helpful. Great, sir. So the moving to the next session, I have my colleague, Angela. In the past year, I have never seen my colleague Angela, who have worked with me more than a decade, have been excited about the single initiative. So it's my pleasure to introduce Dr. Angela Chaudhary, who leads the health vertical of the Health COVID Action Collaborative on behalf of Catalyst Group of Institutions. Angela has over 21 years of experience from pandemic response to health system strengthening to health equity in India and across 25 countries. She is the driving force towards some of the innovations incubated by the COVID Action Collab, which are already showing meaningful results and impact for vulnerable communities. Over to you, Angela.
Thanks, Shankar. I'm so excited to be here today to share with you something I've been accused of spending too much time on. This started from a Sunday cross-country conversation between my cousin and I after we read a publication from the KWR Water Research Institute, and I see a couple of people from there, on how they isolated the SARS-CoV-2 virus from the sewers. This was back in March 2020. This led to many more weekend conversations, a team, collaborations that were multidimensional and domain to where we are today. The premise behind the platform is simple. When clinical studies showed that people who tested positive for the SARS-CoV-2 virus shedded the virus in their stool, it seems to look for the virus, the sewage. Wastewater surveillance outbreak clusters before any clinical diagnosis, especially in areas where COVID-19 prevalent rates are much higher than testing rates. And that is true for the cases of our cities in India and many other countries as well. The problem is that the virus is heavily diluted in the waste stream. So waste is not an easy medium to play with because of all of what goes into it. Not to mention all the junk that is flushed into the bathrooms, from the bathrooms, the chemicals, the pollutants from the environment, as well as animal waste. So surveillance really depends on concentrating particles from the wastewater to detect these very low levels. Environmental surveillance of and in many other countries has the potential to represent a rapid and cost-effective method to support clinical surveillance and may serve as an early warning system to help identify and manage future COVID-19 outbreaks. The virus is shed in feces, therefore its assessment of its presence within communal waste streams can be utilized to potentially determine the prevalence of the disease within the population, contributing to that waste stream. It has been used very successfully, this is not new, to monitor infectious diseases like poliovirus, which we're doing today, and is likely to be a very powerful tool to control COVID-19 outbreaks as it can detect both symptomatic and asymptomatic cases within communities. This information on how the virus is distributed within the communities can then help government agencies to assess the performance of interventions such as lockdowns, micro-containments, and inform the response plan with regards to opening up community activities and implementing vaccine program. Has the potential in countries and regions. We're the first, and we're certainly not alone in this initiative. We're following a handful of pioneering cities and countries that are now adopting this method to plan the COVID response better. Germany, Netherlands, Switzerland, many states in the US, university campuses, and some hospitality companies have started this process. It gives me so much pleasure to introduce you to the Precision Health platform, which is a first of its kind initiative, not only in the country, but perhaps in the region. And proud to say that this is starting in Namma, Bangalore. This platform opens out collaborations across organizations, institutions, governments for tracking COVID through environmental surveillance. And COVID is just the beginning. And where we will overlay with a lot of that is with population surveillance. This, we hope, will be an intelligent wastewater sewage surveillance system to accurately predict climate. Over to you, Shankar.
Thank you very much, Angela. It's now my privilege to introduce Ms. Sangeeta Patel, Health Office Director, USAID India. USAID India is a strong supporter of the COVID Action Collab. The Collab would not be here today if it was not for the unstinting support of the entire team at the Health Office, ably led by Ms. Sangeeta Patel. Sangeeta Patel is a US Foreign Service Officer, senior officer that assumed the duty of Health Office Director at USAID India in July 2019. Prior to joining India team, she served with USAID in Pakistan, Zambia, Armenia, Namibia, and Washington, D.C. She has worked for USAID since 2000, managing programs to advance public health, improve education, promote economic resiliency, provide humanitarian assistance, and strengthen social protection. Sangeeta, over to you.
Excellent. So it really is a pleasure for me to be here with you today and really to support the launch of this precision public health surveillance system. I know that this is an important new initiative, and really it's going to help the city of Bengaluru, as well as even potentially other cities, to really identify clusters of COVID and be better prepared. I think that when we look at what India is facing and when we look at really the magnitude of need, it's really this kind of innovation that's going to help us really get ahead of being better prepared and innovative, and really ultimately track where COVID is and what we need to do to be stronger, resilient, and more prepared and responsive. These are difficult times, and certainly the United States Agency for International Development is really proud to support this work, not only here, but also I know it's part of a global effort happening around the world, as you just heard. And even if it's the first of its kind within Asia, we certainly hope that it builds on platforms such as polio, which have actually been monitoring and tracking disease even through sewage. I think that during these difficult times, it's important to stand with India, to be able to, just as India did for the United States in the early stages of the pandemic, to be really working together closely and in partnership, ultimately to also share with the world what's possible and how to be innovative. This kind of COVID collaboration builds on over 70 years of partnership in the health arena, in biomedical and certainly even behavioral sciences. For mitigating the challenges posed by COVID, USAID has not only been working with the government, particularly in these last few days, especially on the humanitarian needs and oxygen, but even especially with additionally our own assistance partners that have been really working not only to bring in commodities, but again, to provide technical assistance around that and be of support to local governments, as well as even to on the ground providers that are dealing with this devastating crisis. What we know for sure is that our assistance at least has reached $119 million specifically just for India. It's included over $58 million, not only in emergency supplies, but now 60 million, of course, in technical assistance. We know we've been able to reach more than 11 million Indians across the states and territories, and certainly really wish to continue to provide this kind of care, support, and really lend weight to the risk communications, as well as safety precautions that are being implemented universally to strengthen at least support. We hope that this system will be able to strengthen, surveillance and even case finding, and ultimately be able to mobilize the action that's needed even to recognize hotspots and surge areas where there's a need for more responsiveness. I think that this is the kind of partnership, not only at the state level, but even across the government with civil society and even other entities in the private sector, that will allow us to move ahead and get in front and be able able to ultimately change the tide as we go through even this second surge and face even more to follow. Really, we've got to be prepared. And I think the only way really to be prepared is to have this kind of a precision pandemic initiative in Karnataka that's really supposed to be, in my opinion, a game changer to allow us to track and target the COVID-19 response and programs. For over a year now, USAID has supported the COVID Action Collaborative to really enhance pandemic preparedness and really guide relief and recovery efforts, particularly to the most vulnerable of communities. So we're grateful to that partnership, to that collaborative, and even this state level partnership alongside local institutions to really be able to provide the kind of high impact relief that's needed and support ultimately areas such as livelihoods, social protection, and even risk prevention and mitigation. So I certainly hope that today this is the start of an innovative partnership across the city to not only test sewage from different areas and identify clusters of infections, but also be able to early signal where there's a need, especially for decision makers to step in and allocate additional resources. I think that these are the times where we want to work most particularly with the Government of Karnataka as well as the COVID Action Collaborative to really be able to partner together and ultimately to get ahead of really this crisis into a mode really of preparedness, of prevention, and really being able to prevent further surges. So thank you again to the government of Karnataka, really to be able to lead the way, especially in the Asia region with this initiative, and certainly to continue collaboration with us, just as if we've done through USAID in the polio space, really to look at what we can do to strengthen surveillance and really strengthen monitoring, detection, and ultimately our response measures. So without further ado, I hand it back to you and really appreciate the collaboration. Thank you.
Thank you so much, Sangeeta, for your support, guidance, and also leadership. So this is really helpful for us in order to address collectively the COVID pandemic. Our next speaker is Dr. Rodrigo Offrin, WHO representative to India, World Health Organization. Everyone knows what this agency is about. And those who didn't now know even more so. WHO has long been a proponent of wastewater surveillance across the globe and has led environmental surveillance of polio using this method. In fact, we sat delighted as we watched WHO proposed increased attention and investment in this area to the Finance Ministry earlier this year. I have not had the fortune of meeting Dr. Offrin prior to this, so I am honored to introduce you. Dr. Offrin joined WHO India as WHO representative beginning July 2020. Dr. Offrin comes with a rich experience over 2 decades in public health, mostly in WHO Southeast Asia region. His extensive experience and expertise covers critical issues impacting health of the people in the 11 member countries, including India. Please welcome Dr. Offrin.
Thank you very much, Shankar. Good morning, Mr. Rakesh Singh, our Additional Chief Secretary for Urban Development Department of Government of Karnataka and Administrator of the Brahut Bengaluru Mahanagara Palike. Sangeeta Patel, a colleague, Country Director, USAID, and Lucian Chan, Skoll Foundation, and Dr. Angela. Indeed, we are living in interesting times. My life has always been emergency response, whether outbreaks or humanitarian emergencies, but COVID is a totally different crisis. And as Mr. Rakesh Singh was saying, it's also hit Karnataka hard. And although there are decrease in cases across the country, in Karnataka, it's a 22% decrease, but the absolute numbers are still high. It's a 208,000 number of cases in the past week. So we're still not there in terms of a comfortable space. And WHO, with its 2,600 personnel all over the country, including we have a regional office also in Bangalore, working in all different areas of the response, especially the second surge has been intensive for them. We've also managed to provide some supplies, but probably not in the scale as USAID, but I assure you that they're now all in all states, in districts, and being used, whether they're the 4,000 oxygen concentrators, 1.2 million masks. And in states which are under-resourced, we're setting up auxiliary health facilities, but particularly in the East and Northeast, where the surge is growing. Now on that, maybe we can stop a bit, and I really, truly appreciate this invitation. So to discuss something innovative for a better response in the future. And it's not even a response, it's really detection. So you're able to prevent something, another outbreak of COVID to happen. And I think over the past year and throughout the past few months, unprecedented partnerships and collaborations have been the driving force of the global pandemic response. As you said, who knew? For those who didn't know what WHO does, now they do. Since January 2020, these different collaborations with institutes, academe, community organizations have been happening. And I thank the COVID Action Collaborative or hashtag COVID Action Collab for inviting WHO to be part of such an initiative. The Precision Pandemic Platform, which is being launched in Bengaluru in partnership with the Government of Karnataka and with the support of the Skoll Foundation and USAID, will be an invaluable tool for the early detection of COVID-19, not just during the pandemic phase, but for years to come. Wastewater-based epidemiology or environmental surveillance, I'll call that for short later as WBE. We love these acronyms, is an established tool for measuring epidemiological markers in a pooled sample from an area of a neighborhood to identify communities that are affected or at risk of disease. As we are aware, SARS-CoV-2 virus is shed in feces, as already was mentioned, by both asymptomatic and symptomatic persons, which makes WBE a critical supplementary tool for providing information on COVID transmission in the community. It tells us it's an alert system. And I congratulate everyone who has helped launch this WBE platform to provide early warning clues to help the municipalities identifying communities affected by COVID-19 and implement measures to minimize its spread. The earlier you detect, the more you prevent spread, the more you prevent transmission. In the same way as an individual, if you are symptomatic and you get tested right away, you're able to isolate yourself and then you don't spread it further. The same way this surveillance system of wastewater-based surveillance prevents a spread in a community. There is no evidence yet of wastewater or water being a source of COVID-19 infection, but such a surveillance system will emerge as a strong early warning system for once the pandemic is under control, as it will help municipalities, local governments detect emerging spikes in cases in areas where the transmission is low. This approach is replicable in resource-constrained urban settlements for rapid identification and containment of the disease. In the absence of mass whole genome sequencing of clinical isolates, which provide the most accurate information on dominant virus variants in a community and its evolution over time, wastewater-based surveillance is an effective tool as it provides public health information independent of healthcare-seeking behaviors. So it's before anyone or many will be symptomatic, and access to clinical testing in a community. So, since this testing is done on pooled community samples, it is a reliable indicator of the disease burden in that particular group of people. Such sampling, when done at regular intervals and among different communities, helps to establish a spatial and temporal evolution of the disease. I'll go back to this because there's another initiative that we may be able to connect with. Using WBE and containment zones or areas undergoing vaccination can provide an indirect assessment of the effectiveness of control measures undertaken by the administration. And I think the closest example of its effectiveness is actually with WBE in poliovirus that was already mentioned by Dr. Angela. WHO India continues to support the government in using WBE for poliovirus extensively and successfully across India as a supplement to the acute flaccid paralysis surveillance or AFP surveillance to ensure that the country's polio-free status is maintained over the years. This environmental surveillance was established in 2001 with sewage sampling conducted weekly from 3 sites in Mumbai. By 2010, 5 environmental surveillance sites were established in New Delhi, and since then, the number of sewage sampling sites have increased to 56 across states. 10 more proposed sites may become functional by the end of 2021. Environmental surveillance of poliovirus has helped meet several goals of the polio eradication endgame strategic plan. Environmental surveillance supplements AFP surveillance, as I mentioned, in the early detection of circulating poliovirus and in monitoring of progress towards interruption of wild poliovirus or vaccine-derived poliovirus transmission in polio-affected countries. It also helps in early detection of emerging vaccine-derived poliovirus following the withdrawal of the oral polio vaccine. Environmental surveillance also plays a pivotal role in establishing elimination of Sabin-like viruses from circulation following the phased withdrawal of OPV. It also provides support documentation to certify polio's eradication. In summary, the success of waste water-based epidemiology and polio elimination provides a roadmap for the implementation of WBE for other diseases, and in this case, COVID-19 surveillance. This is really a helpful tool to prevent other future big outbreaks and just keep COVID-19 at bay. Now, the other point I was trying to make is that on April 7, the Integrated Disease Surveillance Program, now called in the Integrated Health Information Platform, launched in April 7 nationwide, because it was in a few states a few years back, provides near real-time data to government and public health officials to detect, monitor, and respond to outbreaks of more than 30 diseases across the country. With all states and union territories implementing IHIP, or the Integrated Health Information Platform, it will be worth exploring linking wastewater surveillance data with this system. Because in the IHIP system, you can geolocate. There's a georeferencing. You can tell which hospital they came from, a case, clinical information form. At this point, we're trying to link the genomic sequencing data as well, so that it's all pinpointed and linked, and you can draw more inferences. WHO is currently collaborating also with ICMR to roll out an extensive SARS-CoV-2 environmental surveillance in India, capitalizing on the polio laboratory network established in 1997 and environmental surveillance system established since 2001, as I relate to you. I'm very excited personally. My whole team is also excited to see how COVID Action Collab implements this environmental surveillance in Bengaluru. This innovation, I'm sure, will cascade to other places. And then we look forward to working with you to scale it up across the country for rapid detection, monitoring, and response to future COVID-19 outbreaks. Thank you very much for this opportunity and allowing us to work with you. Thank you very much.
Thank you so much, Dr. Afrin, for your deep insights and also highlighting the global significance of environmental surveillance and also expressing your partnership with us to continue to work on this and also create the positive impact coming forward. Now, it's my privilege to introduce Dr. Lucin Chan. The Skoll Foundation is a champion to this COVID response and keen supporter of the COVID Action Collab. I take pride in presenting to you Lucin Chan, the Managing Director, Portfolio and Investment, the Skoll Foundation. Lucin identifies and advises Skoll award social entrepreneurs on their path to creating a lasting social and environmental change. He has been a friend and partner of the COVID Action Collab and the Catalyst Group for several years. When Lucin heard about this initiative, realizing its significance to the cause, he jumped right into the support it. We would not be here today without the support of Lucin and his team. Lucin is joining us from California way past his bedtime. So I really appreciate it. Over to you, Lucin.
Thank you, Shankar. It's my sincere pleasure to join all of you today to celebrate this important milestone and event and to be able to speak alongside such esteemed partners today. As Shankar mentioned, my name is Lucin Chan and I work at the Skoll Foundation. I'm in Silicon Valley in California. And for those of you who may not have heard of the Skoll Foundation before, we are a private foundation that was started by Jeff Skoll in 1999. Jeff was the first president and employee of the eBay Corporation, the online platform where you buy and sell things. And after making his fortune there, he started this foundation to build a sustainable world of peace and prosperity for all. And at the Skoll Foundation, we look to catalyze transformational social change with social innovators who are advancing bold solutions to the world's most pressing problems. And with COVID-19, we are focused on helping to stop the spread of COVID as well as prevent future pandemics from occurring around the world. As part of this effort, we were pleased to support the work of the COVID Action Collaborative over the last year, as COVID-19 has been spreading across India and the globe. But equally important, we are really excited to be here today to celebrate the launch of this program. At Skoll, we look for innovations that have the potential for significant replicability and scale to create that transformational change that we're hoping to help catalyze. And we hope that this program, in partnership with the government, can show that other cities and states across India what is possible, and that today is just the very beginning of this journey. We believe, as others have said, that this program can be a good test case for early warning and surveillance of future outbreaks and diseases, not just in India, but in other emerging economies around the world. And if that were to actually happen, we feel like that would be truly transformational. We look forward to the implementation of this program and all the learnings and opportunities that will result. I'm sure that the journey won't always be smooth, but hopefully the payoff will be significant through this collaboration. In closing, before I close, I just wanted to express my gratitude to all the partners involved in the program, because you all are the ones doing the work. My job is easy comparatively. And so I wanted to say thank you to PCMH Wellness, Molecular Solutions, CDD Society, Nishaju Envirotech, Swasti, and the COVID Action Collaborative. You really are doing the real difficult work here, especially during such a challenging time. So thank you. I also wanted to express my appreciation for the Government of Karnataka for your support to move this forward and to scale it across Bangalore. I feel that when we're able to bring government and civil society together to collaborate in such a fashion, that great things can really happen. And I hope that this is just the beginning of a long-term partnership that the government will be able to support. In such a horrific and painful moment in time for India, I hope that this program can just be a small beacon of light and optimism that can help us detect and respond to future pandemics and outbreaks more quickly and effectively, and ultimately help to save more lives as a result. So thank you to all of those who were involved in the creation of this and the ultimate success of the program going forward. Back over to you, Shankar.
Thank you, Lucin, for taking time out today and for supporting the Bangalore city-wide response. We have with us very esteemed Shri N. Jairam, Managing Director and Chairman of BWSSP. Sir, we would like to hear a few words from you.
Good morning to all. I'm Jairam, Chairman, BSSB. Along with me, my senior colleagues, Mr. Somshekhar, Engineering Chief, Mr. Devraj, Chief Engineer, Mr. Venkatesh, Chief Engineer, Mr. Rajiv, Deputy Chief Engineer. We heard a lot of things with you people. Last wave, we have conducted this, COVID test in all our STPs. We have around 40 STPs. In all our 40 STPs, we have collected samples and got it tested. Nowhere found no positive. All tests found negative only. So with your guidance, this time also we will work with you people. We want your cooperation, support. All our colleagues ready to cooperate with you and exchange, share the views. Really, it's an opportunity to work NGO like you. Thank you.
Thank you, Shri Jairam sir, for your support to the Precision Pandemic Initiative, which will be a model that we can be sustained and scaled within Bangalore city and also country at the large. Here is a short clip my colleague Florencia has made of the platform. Florencia. Thanks, Florencia, for making this video. Someone said, poop is a brown gold, and it could not be truer when you think of all the information you need to plan, not only public health, but also environmental health and urban planning. Angela will host a short panel to hear from various experts on this matter. Over to you, Angela.
Thanks, Shankar. The Precision Health platform for environmental surveillance has the potential beyond what some of us have even considered. I'm so happy to see many eminent scientists, civil society, those who work with the wastewater surveillance, citizens' voices as participants. I can't overstate the fact that this kind of a platform can be fueled by and power different domains. Allow me to introduce the panelists who I've known and worked with in some capacity. Dr. Giridhar Babu is Professor and Head Life Course Epidemiology at Public Health Foundation of India, with 2 decades of experience in public health research, practice, and academics. He's also worked with WHO in stopping polio transmission, as well as measles surveillance. Dr. Giridhar has served on several national and international committees, including Lancet Commission Task Force on COVID-19, ICMR National Task Force for COVID-19, and the Technical Analysis Committee of Government of Karnataka. Dr. Varsha Sridhar is a molecular biologist, entrepreneur, and innovator. She's an ABL accredited ICMR approved advanced diagnostic company. The focus of her work has been on developing scalable and accessible diagnostic technologies. Mr. Vishwanath is a civil engineer and urban planner with 35 years of experience in water and wastewater sector, with a keen interest in the safe treatment and reuse of wastewater for agricultural and environmental purposes. He's an advisor to Biome Environmental Trust and teaches at Azim Premji University as an adjunct faculty. Dr. Ramkrishna Prasad is a US board certified family medicine specialist, founder director PCMH Restore Health, and vice president of the Academy of Family Practitioners of India. Welcome. My first question to you, and I'll start with you, Dr. Giridhar. Can I see you? Yes.
Yeah.
In the domain that you're working in, what is the significance of environmental surveillance?
So I have worked as a surveillance medical officer in the polio surveillance project also, where in World Health Organization, we have clearly demonstrated what is the strength of using environmental surveillance. So in the wastewater, whenever you find a virus, that means it is the earliest indicator in terms of what is going to happen in the future. So that's one. Two, also when the surge in cases is happening, even if it is not happening in terms of low transmission season, presence of the virus in the sewage indicates that the surveillance that we are doing in terms of health system collaboration is not that robust enough. So this is a very sensitive indicator of understanding what are the ecological ways of transmission cycle which is happening, which is important because it is not only studying human beings which is important, it's also the environment which has a great interplay. So I think from that perspective, doing the environmental surveillance is very imperative. You're muted.
Thank you. Okay, Dr. Varsha, can I ask you the same?
You're muted.
Varsha, you are on mute.
Varsha, you're muted.
Sorry, guys. I was laughing at Andy when she did that, and I did the same thing. I think I'll speak from the domain of health and diagnostics. I think before COVID, a lot of the there used to be a lot of discussion about how we humans, we tend to see ourselves as sort of isolated from the rest of the environment. And really, more and more, we're realizing that what we do affects the environment, and what the environment experiences affects us. So this sort of, it's called a term, it's called One Health nowadays. And so I feel like wastewater surveillance and environmental surveillance in general is a robust step towards getting a better, more integrated idea of how we interact and with our environment, and how that can actually be used as a marker for our own health. So COVID is only one example, but really we can be using wastewater surveillance to look at antimicrobial resistance. And people across the world have actually also used wastewater surveillance to look at non-communicable diseases such as obesity levels in a community. So the potential is humongous, and it's quite exciting. Thank you.
Thanks, Varsha. Vishwanath, hi. How is environmental surveillance got its impact in urban planning and how we live?
Well, I work with the city of Bangalore and its water and wastewater. And as the chairman BWSSB already mentioned, Mr. Jairam, that there are approximately 40 large wastewater treatment plants in the city of Bangalore, treating or eventually treating something like 1,400 to 1,600 million liters per day. Right? So this is 1 million connections. So about 2 million households are sending their wastewater to these wastewater treatment plants. And therefore, these wastewater treatment plants, as already mentioned, become a treasure trove of information and data on the health of the populace. But there's also a significant other role to this. The treated wastewater will eventually go and be used for ecological purposes, agricultural purposes, and other reuse purposes. Right? So that's a downstream impact of it. So our surveillance and data that we generate with wastewater-based epidemiology will not only help us upstream, but also help us to manage downstream. Just one example, the WHO representative very correctly pointed out that there is no evidence of infectivity from water or wastewater sources so far, according to science. This propagation of science to tamp down panic in society is also a very important role of wastewater-based epidemiology. So in this interface between science, the government, civil society, and the community lies the future for this platform. And I'm very excited that this platform will seek the narrative to be pushed in this direction. So that's where I come from.
Thanks, Vishwanath. RK, you're a clinician and infectious diseases specialist. also supporting hospitals with surge capacities. What is a platform like this? What's the significance of it?
Thank you, Angela. First of all, thanks for the invitation to participate on this panel. I think as a clinician and from a health systems perspective, a platform like this can help anticipate, forecast, and prepare. For example, this is one of the signals that comes into play in terms of planning, along with several other signals. For example, we could have, we saw that that whenever there is a rise in cases, you start seeing more cases of fever or people with body aches presenting to primary health centers. We also know that the test positivity rate at labs starts increasing. I have my colleague, Dr. Nishant Hiremat here, who's an emergency medicine physician. He, I'm sure, begins to see larger number of cases with severe COVID presenting to his emergency room. I think the ability to integrate all this, to forecast and plan. For example, my group is involved in running a COVID care center. If these COVID care centers can be initiated when you get the first signals using wastewater surveillance, integrated with other surveillance, then you can plan for surge capacity. You can take a series of policy decisions, public communication decisions, clinical decisions, clinician education and preparedness decisions, which can desaturate the health system, get the right people, the right care at the right time. So I think this is a very promising platform. There remain several questions which have to be answered from a scientific and a policy perspective, but that's exactly what a platform like this can accomplish. Thank you.
Thanks, Arki. I'm going to stay on with you for a few more minutes, if I may. Two things. What does the future of a platform like this look like to you? And you mentioned something about limitations of wastewater surveillance. What else do we need to know to be able to offer some insights?
I think we need, I think the future of this platform, as has been mentioned by several eminent speakers before me, is not limited to COVID alone. COVID, of course, is the crisis of our times, but then this can be extended to antimicrobial resistance. It can be extended to other infectious diseases and perhaps the utilization of medications in society. There are several things that we perhaps need to understand better. Number one, what is the flow of different effluents of medical importance or public health importance, and what are the source points and how do they flow through the sewage system? What is the interface between what is external to the organized sewage system and what is not? Additionally, we know, for example, antimicrobial resistance. One of the, till a few years back, we would always link up antimicrobial resistance in the community, especially at hospitals, to the use of antibiotics. But more and more we find that people, even without risk factors, such as those who have not taken an antibiotic in the recent past, many times present with urinary tract infections, for example, with pan drug resistant E. coli or Klebsiella. So I think that these are things that we can understand. And when wastewater epidemiology can be linked with digital epidemiology, for example, the buying rates from pharmacies of antipyretics or medications to reduce fever, I think, or even antibiotic consumption, I think there's a whole host of things that we need to integrate, understand, and learn better. One final point is about the absolute importance of using wastewater surveillance to understand this, to sequence the viruses that we are finding, to understand the variants, because these may be linked with the local sero prevalence rates. And then one of the things with COVID is we don't know what are the proportion of who has neutralizing antibodies, who has cross-reactive antibodies, and to what extent, and is there any role or risk of phenomena like antibody-dependent enhancement. These remain open questions at this time, which I think a platform like this, integrated with other existing sources of knowledge, can accomplish. Thank you.
Thank you, RK. And I would pass on the same question to you, Vishwanath. What are some collaborations that you're thinking of? What could be some, I'm just at a far roadmap. What can you see for a platform like this? Where can it go?
It's fantastic that it happens in Bangalore. I love the city very much. And the city has some great institutions and some great government support, right, coming from bureaucracy and from the political leadership. So therefore, there are two roles which I see myself where the platform can head. One is, of course, what is now the current focus, which is SARS-CoV-2 and COVID, right? But later on, as has been mentioned, for other diseases and for tracking other viruses and bacteria. But let's also look at getting collaborations from sanitation engineers, from agriculturists, right? The reusers of this wastewater. This wastewater and the sludge generated in the sewage treatment plants are a terrific resource. They can help irrigate hundreds of acres or hectares of land. They can provide fertilizers to large chunk of agriculturalists and provide livelihoods. Now, if it can be done in a safe manner, by science understanding what the risks are, we'll be helping ourselves a lot, right? In the domain of economics and livelihood of people. Second important thing is, I had the opportunity of working with something called the Sanitation Safety Plan developed by the World Health Organization, which is a risk-based approach to managing waste, right? Now, for me, the Sanitation Safety Plan is an excellent tool to work further with the collaborators in understanding the waste flows in our cities and managing them and de-risking them, again, based on data and knowledge. The last point that I wanted to make is that the collaborations need a certain level of incubation, right? It needs a skill to bring together different disciplines and different sector people. And therefore, hopefully these kind of disciplines will come together in this platform, understand from each other what they perceive as risks, and take the agenda forward for this city at least, and therefore as a replicant for all other cities and all other places in India.
Thank you so much, Vishu. Varsha, what are your dreams for a platform like this?
I actually have a combination from what RK and Dr. Vishwanath had said. Looking at microbiomes, really, we know that microbiomes really affect not only our own health, but also the health of our future generations. And microbiomes, really, how does what we eat and what we get exposed to affect our health and the health of our kids? When you look at something like wastewater, it really kind of is a nice conduit between poop, human poop and animal poop, and then the same water that goes into agricultural fields. How does that same thing, the microbiome from all the stool samples that are coming into the sewage, and then they go into agricultural fields, where they of course fertilize our crops, and then they come back to us as our vegetables. How do you now see, can you actually track the flow, not only of antimicrobial resistance genes, but also say of chemicals, heavy metals, things like that? How does one community which is perhaps exposed to very high levels of heavy metals, that affects the wastewater? How does that affect the agricultural produce that is then irrigated with this wastewater, and so on and so forth? So I really see this as perhaps being a great biorepository that other researchers, we may not be in a position to answer many of these questions or even ask the right questions over here. But when we create a repository of wastewater samples, and down the line, maybe this can be extended to soil samples, and this can be extended to the stool samples of the people in specific communities along with these things. Of course, there would be privacy issues over there, which we would have to work out. But at least when you look at environmental samples such as water and soil, that perhaps can be used as a repository for researchers across the world to come and ask the right questions and use these samples to answer them. Thank you.
Thanks, Varsha. And Dr. Giridhar, same question to you as well.
I'll continue with the excellent response by Dr. Varsha. So in my own assessment, creating these platforms are useful for bringing in people together, for bringing organizations together, and for ensuring that there are sustained efforts for not just for research for the sake of research, but also to have some meaningful actions which are linked to this research. So most platforms either are serving only one particular purpose for which it is built, and then they don't find utility in integrating the purpose of several other organizations. As Dr. Varsha clearly explained, if you are building a platform which is meant to be a collaborative platform, and you are inviting the researchers to pursue their research question in that, you are inviting probably some of the organizations to try out some interventions using this platform. You're also getting the government to use this platform for monitoring their progress. I think that's the ultimate success, and not many platforms are created as such, Angela. So therefore, having one thought of this broad vision and also long-term focus, I think this is really novel. Even in Bangalore, there are many groups who are working on One Health agenda. And with this platform, I think there's a greater collaborative effort that we can visualize for the city as such. And this can be replicated in the other cities in the near term. In the long term, we'll definitely have meaningful collaborations globally as well. Over to you.
Thank you, Giridhar. And thanks so much. I was just looking at all the participants lists, and I can see, colleagues from KW, Water Research Institute, Rockefeller Foundation, a lot of people who I've been speaking with, CCMB, NIV, that I've been speaking with, who are interested and doing some significant work in this area. So I'm very honored to have such a wonderful and eminent audience. Thank you so much for taking all your points. So we're creating it's a good way to make the roadmap for the platform, because we hadn't really thought about where this platform will go at the really long term, and all of you panelists have really laid it out clearly and with very exciting insights on agriculture and microbiomes, food, water, literally intersectionalities of what well-being really means. So thank you for being here today. I know this, you're all terribly busy in the second wave trying to save lives. So please accept my deep appreciation. Before we close today, it's 11:30. This initiative would not have been possible without the multi-domain, multi-sectoral commitment and collaboration of eminent experts and institutions. I'd just like to name a few of the people who were in this journey for the last year and a journey moving forward. Dr. Paramita Basu, Dr. Indranil Nandi, Sandeepan Chaudhary, Nitya Jacob, Dr. Raman Ganga Khetkar, CAC, COVID Action Collab Governing Council members who took a keen interest and guided this along the way, and Dr. Swarup Sarkar and Srinivas Upaluri, and the partner agency partners who are working very strongly on the ground, PCMH Wellness, Molecular Solutions, CDD Society, Neshaju Envirotech, Catalyst Management Services, and my team at Swasti. And last but certainly not the least, the leaders here, Government of Karnataka. This cannot be possible without strong interagency collaboration between BWSSB, BBMP, KU, WSB, department. I will end now with this video.
What seems impossible is only a point of view. How we make it possible lies within me and you. It starts with opening our heart to a true sense of community, to celebrate its every moving part and serve our deep humanity. Driven by collaboration and vigor, we will bounce forward. And how? Together with them, him and her. A new world resilience now.
Thank you everyone for a very precious 1 hour that we've spent here together. We look forward to inviting you to our collaboration and working towards making a safe space for everyone. Stay healthy, stay safe.